So the U.S. Food and Drug Administration says at least 60 million doses of the Johnson & Johnson coronavirus vaccine that have been produced at a plant in Baltimore were actually contaminated. The FDA ordered the company to discard the doses but cleared about 10 million doses for use. The South African Health Products Regulatory Authority is now expected to assess the Johnson & Johnson vaccines that have been stored at the Gqebherha plant in the Eastern Cape, and that's to ascertain whether they are in fact safe for use in this country. But what should we actually make of the blunder that's taken place in the United States? Well, let's speak to Dr. Ntuthuku Bhengu, who's a health expert as well as founder of Alchemy Health Technologies. Dr. Bhengu, great to chat to you. Thanks very much indeed for your time. So the FDA, in making that much anticipated announcement yesterday, said, yes, millions have been contaminated, but also, yes, there are millions others that will be released for emergency use. The big question for us in South Africa is, are the doses in our possession part of those to be discarded or those that can be used? We don't have the answer to that just yet.
Yes, good morning, and good morning to viewers of Newzroom Afrika. No, thank you very much. You've led on with the right sort of questions. But what needs to be remembered is that really, as difficult as the situation is, there are a few key issues to point out. For example, the National Department of Health, the South African regulator, or even ascertain, our local manufacturer, are not at all cited as part of the problems. And also the other point to make is that, look, there are doses that are being released. You're referring to 10 million and 300,000 to South Africa. What that confirms is that we are not dealing with issues of safety or efficacy in the broader sense. It's really more a quality issue, but even then, for a very well-defined and now identified batch of vaccines. I think just to understand this a little better is that South Africa subscribes to the global standard of good manufacturing practice.
Right.
One of the key advantages of that is that every vaccine that's manufactured can be traced to a factory, can be traced to the date it was manufactured, by which machine, and the operators. This is the reason that we are able to isolate the 60 million doses and be able to discard them and be able to say others are actually usable. Now, how it affects us, of course, is that it's not news that Aspen was actually involved in filling and finishing the product here, which basically on its own means that the active substance is produced elsewhere and imported onto our shores. So I imagine that's exactly the question that SAPRA needs to validate and assess, that are the doses that are ready for consumption locally, do they contain the substance of interest that will have come from the specific batches in Baltimore, Maryland, USA.
I wonder, Doc, whether we can speak to the detail around how we actually got here. A contamination of this scale, does stuff like this happen, or does it point to grand-scale negligence, for lack of a better term, at least on the part of this Baltimore plant, where we understand the problem actually originated?
Yeah, I think the issue here seems to be the contamination of the Johnson & Johnson vaccine with the AstraZeneca.
Right.
I don't know if the specific example were two products in this fashion, but one can assume that the reasons are there precisely because there is a need, so this sort of happens. But let's not only focus on the manufacturing industry. What we can understand more is if we think about the whole point of product recall, which can affect any industry. But one always needs to have context here. Just because, for example, a car spontaneously bursts into flames doesn't mean you write off the entire brand. It is known which model of which year is recalled to be fixed. And in parallel with that, you cannot now write off the whole of automotive engineering as a field because of that. Bringing it back to vaccine, I repeat that the key issues that regulators want is that the products are safe, efficacious, meaning they work, but also that they are of good quality standard. We are not dealing with a science problem here. We're not dealing with a medicine or epidemiology problem here. We are dealing with a manufacturing problem for a very specific batch, which thankfully has been identified. And one can say that the system actually worked, because while I was talking about product recall, the early warning signs came before the product was even released, which is why it can be destroyed even now, the 60 million doses we're talking about.
Right.
Of course, it's still a developing story. We don't know what will come out of Gqebherha.
Absolutely. And we're watching with bated breath. I get why you are emphasizing what you're emphasizing, because you and I both know that these developments can very easily lead into things like vaccine hesitancy, which is a challenge the world over. Before we speak about how even our government can respond to that specific issue, let me get a sense of what we can do from here on. Many South Africans will be asking themselves, if we can kill viruses in bodies, why can't we, in some respects, kill contaminants in vaccines? It's a rudimental question, and clearly I'm not a medical expert. But help us answer that question nonetheless, because many people will certainly be wondering why we can't go down that route. Just remove the contaminant.
Yeah, I think the point here is that when you are talking about production and manufacturing of intravenous, or rather, let's just call parenteral products, meaning that they are administered through other means other than through oral intake, so you don't ingest it by swallowing. This largely is now about the injectables, whether into the muscle or to the vein. You are actually depositing the vaccine directly into the bloodstream. So the responsibility to be extra careful is that these are very sensitive to contamination, which is why the actual production of this is in very specialized facilities under extremely sterile environments. That is why in South Africa, until recently, Aspen had a facility to take this over. We've got quite a lot of facilities that manufacture medical products in general, but very few on sterile products like this, precisely of the need to be super careful to keep contaminants out. So it's a process that's best managed by preventing the contamination instead of cleaning it post-production.
Yeah. Let's speak then about ways of combating the vaccine hesitancy that may come out of this, especially considering, Doc, that what the FDA has actually said, even about the 10 million doses, is we aren't necessarily sure about whether or not these vaccines can be used, but the countries that have them can go ahead at their own risk if the vaccines pass their own regulatory tests. Why then would any country want to use a jab that the FDA says they can't necessarily guarantee the safety of?
Yeah, I think it's really more in the messaging, but you are pointing to a very important point of vaccine hesitancy. And the unfortunate thing is that COVID has made it such that the whole point of development and utilization of vaccine is happening in broad daylight, unlike in many other instances. You actually are changing the engine of an airplane in full flight here. So any small mistake will be picked up. But I don't think it's the messaging, but it goes back to the FDA saying the local regulators need to do extra work. And I would say in South Africa, we're very lucky to have a regulator that is as conservative as SAHPRA is, because we're dealing with lives here. there is really only one chance. I mean, I know 2 years ago we had a case of people being resurrected. Unfortunately, it's not yet at scale, so we must deal with it first time properly. I do not think that this is really necessarily terminal from a vaccine hesitance perspective. I think it's down to the messaging and emphasis that we are not dealing with safety and efficacy. And I went to the FDA website, a letter dated the 10th of June, that's 1.5 days ago. It's very clear. It reissues the initial permission to use the under emergency use authorization, confirming that nothing has changed from that. So it's really about dealing with at manufacturing level, at factory level, and we have to depend on SAPRA. And incidentally, one of the newly released articles I found on Nature, that respected journal, goes on to, and this is dated 9th, again this week, goes on to confirm that the J&J vaccine elicits a strong response, not only to the original variant that was found in Wuhan, but in also 4 other subsequent variants, now termed the alpha, beta, gamma, and I think California, Southern California variant. I forget the actual new term now. So it's really about dealing with product that has been identified, and for that we have to move on and make sure that the protections remain in place for further manufacturing.
In the midst of all the uncertainty, you do make a good point. This is not a science problem. It's more about the manufacturing post the science. Hopefully it is a kind of, call it precautionary insight that people will remember throughout this development. Thanks very much indeed for your time. Really appreciate your insights. Dr. Ntuthuku Bhengu is a health expert as well as founder of the Alchemy Health Technologies. Once again, thanks very much indeed, Dr.